Good afternoon, everyone. This is Andy Reese, Director, Department on Disability Services. Sorry, bear with me for just 1 second here. There we go. So I'm sharing my screen. Okay. So as of yesterday afternoon in the district, 421 people supported by DDA have tested positive for COVID-19. And in terms of the placements these people are in, this represents 6 people in host homes, 114 people in intermediate care facilities, 1 person in a mental health facility, 53 people in natural homes, 2 in a nursing home, 4 in an out-of-state placement, 37 in residential habilitation, and 204 in supported living.
Excuse me, Director Reese, your screen didn't change.
Did that change it?
It did, but you're also not in this display mode or the slideshow mode. You're in.
Here. And now?
Perfect.
I have it on 3 screens. And so anyway, so now what we are looking at is infection rate and the deaths by placement type. In ICFs, there was no change this week. So of the 114 people in ICFs who have tested positive for COVID, this represents about 38% of the people in ICFs. And of those who have died from a confirmed COVID death, they represent about 10%. That's 12 people in ICFs who have died. Of the people in ICFs who've been diagnosed with COVID and subsequently have died, there are 23. So there are 11 who either the cause of death has not yet been determined or it was determined not to be COVID. In natural homes, there are 53 people diagnosed, which represents about 5.7% of people in natural homes. And of those who've contracted COVID, in natural homes, 5 have died, which represents a little less than 10% of the people with COVID who lost their lives to COVID. In residential habilitation, there were 37, which represents about 34% of people in residential habilitation. And of those, there were 2 who are confirmed to have died from COVID, which represents a little over 5%. And there have been 3 people overall who have died who had COVID, representing 8%. In supported living, 204 people who've had COVID represent about 22% of the people in supported living. And of those, confirmed COVID deaths is 6.8%. And that represents 14 people. But overall, of people in supported living who had COVID who have subsequently died, there have been 20, which represents almost 10%. So overall in DDA, the 421 people represent about 17.5% of the people supported, with 53 overall deaths, which is 12.6%. But of those, 35 are confirmed as COVID deaths, and that represents about 8.3%. So in the month of March, there have been 11 people who have contracted COVID, and of those, 8 were in supported living and 3 were in a natural home. And in March, of the 11 people, 3 have required inpatient care. And there are currently 2 people who are still in the hospital. And as I had indicated, people diagnosed with COVID who have died, there are 54 people who have had COVID who have died. 12 of those have been confirmed cause of death, something that was not COVID related or other than COVID. And for 7, we are still awaiting confirmation from the medical examiner or a doctor of the cause of death. And so that total, there have been 35 people who have died from COVID, where COVID is confirmed as the cause of death. And none of the deaths in March, as of yet, have been confirmed as COVID deaths. And among the provider staff, 5 additional staff tested positive in the last week for 671 provider staff who have tested positive for COVID. 48 of these work for more than one provider, and we have lost 10 provider staff to COVID. People may have noticed, if you watch the mayor's press conference each week, that a new mayor's order has been issued. The public health emergency has been extended now into May. There are limitations on how long the public health emergency can be extended by the city, so that's why they keep doing it in increments. We are still, to be clear, in phase 2 of reopening. The mayor did make some changes within phase 2, expanding some number of people that can gather together, allowing for some changes in restaurants, opening some, allowing some places, or some places choosing now to be open. The zoo is open. So there have been some relaxing of the restrictions in phase 2, but to be clear, we are still in phase 2. And for providers, you should continue to monitor DC health guidance regarding any changes in practices in provider locations. Because I know that at about the same time the mayor issued the new order, she also talked about some of the guidance for the health guidance for people who have been fully vaccinated and are 2 weeks beyond being fully vaccinated, when you're considered to have developed as full immunity as possible, that people can then, if they personally are visiting with someone and that other person is either low risk or has also been fully vaccinated, that those people could visit with each other without a mask. But none of these changes have changed any of our practices in any of the placements supported by DDA. It is essential that people remember that while we have moved down the road some, while we are feeling some sense of hope as people are becoming vaccinated, and you can begin to see a light at the end of the tunnel, we are still not there, and it is essential that people continue to take all of those measures that we need to have been taking for the past year, of ensuring that we're wearing masks whenever we're around people who are not household members, that we are keeping a safe distance from people, and that we are washing our hands regularly. In terms of vaccination, there has been some progress on this front. We had spoken a couple weeks ago about the changes that we made to MCIS so that providers could upload documentation as people become vaccinated, so that we can be able to report on that data. Some providers are still not up to date with entering their data, but based on the data that we have in MCIS, we have documented approximately 30% of people supported who have been vaccinated. Based on looking at the data and knowing who was at some of the clinics recently, I know that there are providers who have not yet entered the data. So it is essential that providers enter that data so that we can have current data to report. The same goes for our provider staff. We have the best outcomes, fully vaccinated people in staff in ICFs, or fully vaccinated DSPs in ICFs, were at about 36% overall. Fully vaccinated in residential habilitation, 27%. And then in supported living, it's only about 16%. I think what's important to note about these percentages, for one, this is what has been reported. And secondly, as I look at the data of what's been reported, there's a significant range amongst providers. So we have providers who have reported no data of staff being vaccinated, up to providers that are at about 90%. And so, there's a whole range of outcomes for providers regarding having their staff get vaccinated. I think I spoke last week about the fact that we asked our providers at the provider leadership meeting, those providers who have had some successful strategies to get vaccinations done, we asked them to share what those strategies were so that the providers who haven't had that same success could learn from that. So we hope to see these numbers increase. Today, we have Donald Clark with us, who is going to share some information about our webinars, I think it is, that we have regarding technology.
Yes, good afternoon, everyone. Just wanted to come back to this forum, as I did previously, to just do the plug again that the Tech First web series has in fact kicked off. We've had two to date, one on the 19th and then one yesterday. We started off the web series focusing on data sets for assistive technology goals We welcome Krista Obstadal from Calix, who's a assistive technology assistive technology coordinator, and really showcase some creative and innovative ways to look at tech and how you can implement them in people's lives and create goals around them. And we also yesterday had Community Living Tech, where we showcased the remote supports technology by NextGen AT, and also discussed some other emerging tech that is being used to assist people being more active in their communities and navigating from point A to point B. Yesterday's webinar really had a good turnout. Over 100 people attended, a large representation from our provider network. I just encourage that, again, that these opportunities are available to all stakeholders, internal and external to DDS, to learn about emerging tech and also learn some best practices. In particular, for April 8th and 9th, we'll have remote supports part 1 and part 2, which I believe is very prevalent to what we're going through today and trying to figure out how to ensure continuity of services and supports. Part 2 will take a look at intro to remote supports options, as well as common use cases, benefits, and risks. And part 2 will lead into some more, take a deeper dive and really equip attendees with some best practices around remote supports planning and implementation. So I've really encouraged people to check out April 8th and 9th, because I think it relates to what we're going on today. But the flyers have been disseminated, and I can send them out again to all parties to make sure you are available of these webinars that will run from March to August. So again, I encourage you, please come out, learn about some tech solutions, and also learn how to apply some things along the way. And if you're excited about any that you see, you can always reach out to me and I can connect you with some of those tech solutions if you want additional conversations with them. Thank you.
Thank you. And just as a reminder, if anyone has questions, you can type them in the chat. Make sure that you type them to everyone. I do see there's a question. Does the 30% vaccination statistic for people supported by DDA mean fully vaccinated, or does it include people who've had 1 dose of a 2-dose vaccine? That includes everyone who has received at least 1 dose. And very clearly, I will say, it is an undercount. And so that's why, I'm encouraging providers to make sure that you're uploading the documentation of this, because, we do know that this week we had our 4th week of vaccination clinics that were offered in a coordination between DC Health, DDS, with Giant providing the vaccines. And over 300 people get vaccinated each week in those. So clearly there is a little bit of a delay in uploading all of the data. Is there a refusal form in DDS for a person who doesn't want to take the vaccine? Winslow, can you speak to that? Because I do know that people who have wished not to take the vaccine, the process with them of making sure that we document their refusal. But I don't know if there's I don't think there's a specific form for this vaccine as much as there's a regular refusal form. But anyway, if you could speak to it.
There's a refusal form for vaccines, but this likely has not been added, and I'll check with Health and Wellness to see that it's added. So there are people who don't subscribe to vaccines, and we do document that on a particular form for that purpose, and the corona vaccine has not been added. But we do document their refusal in the MCIs when they state it.
Will the vaccination clinics continue? And if so, for how long are they planned? At this time, there's not a subsequent one planned. In fact, this week, we had trouble filling all the slots available. One of the things that we are working with DC Health on right now is coming up with the mechanism to deliver vaccine to people who are not able to go out to get it. And then continuing to look at, as we get complete data uploaded into MCIS, looking at, we don't document just who got it, but also when people didn't get it, what was the reason, identifying what those barriers are, and then addressing those barriers to the extent we can. And I'll just remind people, you can go to coronavirus.dc.gov, the website there, to log into the portal to register to get a vaccine. When you go into Vaccinate DC within that portal, you will also see all of the other options for registering to get a vaccine. So these special clinics that have been arranged are certainly not the only way that people can obtain a vaccine. And vaccine is becoming more available. People can, all the different hospital systems, as well as Kaiser, or if someone is connected to any of those, if you've visited any of those hospitals in the last 2 years, I think it is, you're part of their system and can register with them to get the vaccine. And then there's also a list of the clinics. If anyone is connected with those clinics, you can register with them. And you can register with the DC portal. You can register for all of them and see which list you come up on first. This is an unsolicited idea. I assume it's for DC Health, who I expect is with us. The DD Council in Delaware supported a program that put nurses on paratransit and took them to people who couldn't leave their homes. It sounded like a good partnership. Perhaps DC Health and Metro Access could try this. By put them on paratransit, I don't know if that means they vaccinated people on their ride somewhere, or they used the paratransit system to have people go to people's homes. As I said, DC Health is working on a system for outreach where we'll be able to deliver vaccines to homes in the district. Were the slots at the clinics offered to people living in natural homes? Yes. And is vaccination data being collected on them? Yes, it is. So for anyone who gets in-home services, that provider is expected to upload. For people who are not receiving waiver services, the service coordinator is entering the data. And we did reach out to all people, either through folks connected to a provider. We reached out to the director of nursing, and for the folks who are not connected to a provider, the service coordinators reached out. So apparently in Delaware, they had a mobile vaccination bus. So I do know, and I don't know if anyone from DC Health or perhaps Kirk knows the specifics. DC Health is currently in the process of finalizing their plans to deliver vaccinations to people who cannot leave their home. That's people supported by us and generally in the city. And they're not doing that with Metro Access. I'm quite certain of that, but they are delivering the vaccinations to the people's homes.
That's correct, Dr. Reese.
Or the plan is to do that. I don't believe it has started yet.
It has not for DDS supported people. Sorry.
I was just checking to see if we're still people here. There are 190 people here. There is a question, is the information from last week's provider leadership meeting available? No, because they were verbal presentations. I don't think any of the providers had visual presentations or any kind of PowerPoint that could be shared. One thing I will say, and this is just from having listened myself, and other people could type in what their impression was, what seemed consistent to me across the board was amongst the 4 different providers that presented was that they all had many opportunities for education. They heard from people about what their views were about taking the vaccine and provided them education about the realities of the vaccine. And they did that on more than one occasion and have offered lots of occasions for people to ask them questions and to discuss the issue of the vaccine. So it seemed to me that these providers that really used the strong health services within their provider agency and a trusted source of information to be able to hear people's questions and answer them and to be comfortable sort of allowing people to learn at the pace that people learn. So coming back and answering the questions that people have and really creating an environment where people could ask any questions they have about the vaccine. That seemed to me to be what was consistent across all the agencies. So as the weather is getting warmer, where is DC Health on people in ICF settings going out into the community? Have they updated their guidance? Just to be clear, getting out into your neighborhood and exercising is essential, has always been essential, and has always been allowed. So for people who are in ICFs, who want to go to the park, who want to take a walk around the block, those kinds of things have been and are not only allowed, but encouraged. People need sunshine and exercise. As DC Health guidance is updated, we will share that. So there was also information and slides from, so any slides that were shared at the provider leadership, it sounds like someone would like for us to share those. I don't know that we have and Kirk, you can respond to this. I don't know if we have the DHCF slides, but we can certainly ask for them.
So Director Reese, the recorded and all slides presented will be going up on the website in a dedicated provider leadership tab. Just haven't been able to get it created yet, but yes, it will be. There will be presented or posted. I apologize.
So this person says they're talking about grocery stores, shopping, vacations. That has not yet changed. And it says especially for people once they are fully vaccinated. And yes, I don't know if we have Vince with us today. I know that DC Health, Nelson with us today. DC Health, I know, has been working on updating a lot of their guidance. And maybe you could speak, Nelson, if you're able, about sort of the status of any changes to DC Health guidance.
Thank you, Director Reese. We are still updating a lot of guidances as they get released from the CDC and as we get new information to evaluate and apply as is best for our specific community and the DC residents in DC. I think, to quote the mayor in her most previous press conference, the relaxing of restrictions is not going to be cookie cutter for every place across the nation, and between different settings, it's going to be different. And so we need to be very careful in the way that we apply some of these recommendations in the specific settings. Sorry, I apologize for the dog barking. Also, we are expecting some guidance to be released from the CDC soon related to long-term care settings and ICF and CRF and things like that. And we're just awaiting for that guidance to be released. And just as with any other guidance, as soon as it gets released by the CDC and we get new information, we will do our best to, as quickly as possible, evaluate it and apply it as appropriate.
And as these guidances have been updated, DC Health has then updated us on these calls about those changes. So you will hear it here, but you should also regularly check the coronavirus.dc.gov website because that has all the current guidance on it. There's a notice here. People should check out a video from Large about accessibility in medical settings, and there's a link to that video. And so for people who are on the phone and can't see the chat box, The video can be found at https://larche dash gwdc.org/my voice. And there's also the link in the chat box for people to access health guidance that is on the coronavirus.dc.gov website. So I don't see any additional questions or comments. It's 12:44. We could leave it open for another minute. And if people have questions, those last minute questions that occur to you just as the meeting ends, please type them in and we'll respond. Otherwise, enjoy at least half of what's supposed to be a beautiful weekend. The first half, tomorrow is supposed to be sunny and nice out. And as I said earlier, continue to be safe. I was talking to someone about this morning, how there's a feeling of hopefulness right now because the vaccine is out there. There's more vaccine, but that is a feeling. And please don't allow that feeling to cause you to relax all of the really important steps that you've been taking to maintain your health in the meanwhile, so that we all make it together to the end of this. Just to repeat, someone from Health and Joy has posted here a link. Health and Joy has a monthly remote virtual Zoom party, and the link for that party is here in the chat. And I do know, it's interesting when folks went to get their vaccine, that was a wonderful opportunity for many folks who have been at home all this time to see people who they knew who they haven't been able to see. So I'm hoping that this kind of, virtual Zoom party might provide that same kind of opportunity for people to connect with folks who are outside their residential circle who they can now visit with. So I'd encourage people to participate. And have a great weekend and a good week. And I will speak with people next week. Thank you.